Awesome. Well, welcome to the workshop for today. Huge thank you to Chris and Physio Room for kind of initiating this. This is a topic that I think is really exciting to me because I think especially since COVID, we've been seeing so many patients complaining of hip issues, and it's really hard for patients to understand, is this something that can be worked through with changing activity or physical therapy or conservative measures, or is this something more worrisome like arthritis that needs to be further evaluated? So hopefully this is just a very basic overview that will kind of help guide you guys in terms of determining what maybe the source of your pain is and what things to do moving forward. Really the goals are to just kind of understand some of the more common reasons. This is by no means an exhaustive overview of reasons for hip pain, but kind of some of the more common things that are top on my differential when I'm evaluating somebody with hip pain. We also want to make sure that you understand some ways to help with your hip pain that do not involve surgery. And these are also very general things. They kind of sometimes need to be tailored depending on which condition is affecting you, but just some good things to start with to help with pain. And then really trying to identify when further evaluation or surgery may be needed is what we'll also review today. So for those of you who don't know me, my name is Lindsay Kleeman-Forstuber, very long last name. You can call me Lindsay, Dr. K, whatever works best. And my specialty is in orthopedics with a specific focus on hip and knee conditions. So that's kind of what makes me qualified to be talking to y'all today about this topic. I did most of my training on the East Coast and then had the opportunity to do my fellowship here at Colorado Joint Replacement based out of Porter Hospital in Denver. And I am now one of their new attendings at Colorado Joint Replacement. We have two locations, one at our main office at Porter Adventist Hospital and then a new location down closer to Lone Tree. So the biggest question on everyone's mind is, why does my hip hurt? And there's so many different reasons why people can have hip pain. I think the major things that help determine what the source of the pain is really, where is the pain? What does the pain feel like? And when is the pain worse? So as you're kind of listening to your own bodies and trying to determine what you think the source of the pain is, these are kind of the three things that I would like you to try and hone in on with your body. So talking about where the pain is located, location is so key to figuring out where pain can be coming from. And as you can see, there are so many different areas around the hip that can be sources of pain. Pain that tends to be more in the growing region or kind of in the crease of your front area is usually more concerning for something actually related to the hip joint itself, such as arthritis, a labral tear, or even sometimes a stress fracture. Pain that's kind of more along the outside of the hip is usually more indicative of soft tissue issues. And then pain kind of in the back area usually is soft tissue or sometimes some things related to your back. But as you can see, there's lots of overlap with these conditions. So while the location is helpful, it doesn't always answer all of the question. So the next thing is kind of describing, how does the pain feel? Because the quality of the pain can be very indicative. So sometimes patients will describe a snapping or a catching sensation. And depending on where that snapping or catching is located, it can be indicative of issues with your IT band, which is a soft tissue structure that runs along the outside of your hip. The image shown here is more of a hip flexor tendinitis, where sometimes you can get snapping of the hip flexors of your hip that control the ability to lift your hip to your chest. But snapping can also be indicative of a labral tear, and we're going to talk a little bit more about that later. Patients who are describing a sharp or shooting pain, this is also sometimes referred to as electrical bolt type of pain or lightning that runs down their leg. This is usually more indicative of a nerve etiology. So if there's compression of the nerves in your leg at any one area, they typically cause pain consistent with this, but you can certainly have sharp or shooting pains from things like arthritis, tendinitis, or bursitis. So it's not always the full answer, but does help us hone in on what the source is. Aching or throbbing pain is usually more soft tissue or joint related, and kind of depending on where that pain is helps us hone in. Again, a long differential of things that can be caused or can cause aching or throbbing pain, but that's another thing we classically see. And then if you feel anything associated with numbness, so if you try to touch the bottom of your foot here, we're using pins. I don't suggest that you take a sharp object like that and touch the bottom of your foot. But if you try to stroke the bottom of your foot and it doesn't feel normal to you, or feels like a pins and needles feeling, that's usually something more indicative of a nerve problem. So next, talking about when is the pain worse, and kind of as like a side to that too, trying to find out when is the pain better. These can be very helpful things. So usually anything like walking, a weight bearing activity, is usually pain from muscles or irritation of the muscles when they're engaging, or pain from the hip joint, because when you're walking, you're loading that joint. So any problem inside the joint will cause you pain. Sitting for long periods of time, this is another thing that can help us identify where the pain is. If you're having pain kind of in the posterior aspect of your buttock, sometimes that's sciatica or compression of the big nerve in the back of your leg. But also stiffness or aching pain with sitting long periods of time can be indicative of arthritis. So, for some patients, sitting actually makes the pain better, and that sometimes is more indicative of a soft tissue injury. So that's another thing that can really help us hone in. One of the classic questions I ask somebody when they're coming to be evaluated for arthritis or something like that is, how easy is it for you to put on your socks and shoes? Typically with arthritis or labral issues, patients have a lot of difficulty just because this position puts a lot of stress on the hip. So if you're finding that it's becoming increasingly difficult for you to put on your sock and shoes, sometimes that does indicate a hip arthritis or hip related issue. And stairs is another thing. Some patients actually get relief of their pain when climbing stairs. Some patients get worsening pain when climbing stairs. And that can also help us hone in on what's the source of the pain. Pain that's coming from the back sometimes actually gets better when you climb stairs because you're in a more hunched forward position. Whereas arthritis and pain like that, this is more loading of the joint, so it's going to make that pain worse. And believe it or not, I actually can get a lot of information from patients based upon how comfortably they can sleep at night. If they're a side sleeper and they start telling me, gosh, I cannot sleep on my side anymore, that it really helps me hone in on where the location of the pain is and what the source is. If sleeping is the only time you do get relief, sometimes that indicates a back or a hip issue. So sleeping is also very helpful. So now we're going to kind of transition into the most common hip conditions. Again, this is not an exhaustive list. These are just kind of the more common ones we see. So bursitis is probably the most common thing I have seen post-COVID. And what bursitis is basically it's an irritation of fluid-filled sacs that are in between muscle groups. And the most common location is really over the prominent part of your bone on the outside. It's called the greater trochanter. So what this picture is showing you is this prominent part of the bone here is your greater trochanter. And it is an attachment site for multiple different muscles that control various functions of your hip. And because you have so many muscles attaching here and they're rubbing up against one another, you can get lots of friction. So that's what bursa are designed for. They're these fluid-filled sacs that try to help and dissipate those frictional forces. But sometimes when the friction is so high between muscles, the bursa themselves actually get inflamed. And this can be a very painful condition. Usually greater trochanteric bursitis is the most common one we see. So what this condition usually presents with is pain, usually on the outside of the hip. The quality can be anywhere from sharp to burning to aching, but it does tend to be worse with any kind of a walking activity where you're trying to stabilize your pelvis by engaging those muscles. Stairs also exacerbates it because, again, you're trying to stabilize the pelvis. And the biggest one for me is if patients are saying they have pain with lying on their side at night, that's a big red flag for me that this might be the reason for it. The reasons for it, it's usually is an overuse or an underuse thing, usually meaning if you were maintaining a certain activity level that you're not able to do anymore and these muscles get weak, that's kind of the reason I've been seeing a lot of it post-COVID. But sometimes if you've been overworking the muscles and they get inflamed just from that, that usually can cause it. Good news is for this condition, the treatment really is conservative, meaning it's not something that needs surgery. It just involves usually modifying of activities, anti-inflammatories as needed for the pain, sometimes a walking pole or assisted device, and a very good physical therapy program. And along those same lines, tendonitis is another very common condition I've seen. The difference between tendonitis and bursitis is this is actually inflammation of the muscles themselves at the tendon portion, the part that attaches to the bone. And this, I think, is a better picture to show you. Look at all the muscles that attach. This is actually underneath there is that greater trochanter we just talked about. And all of these muscles are attaching in this area. So you can imagine that a lot of tendons can get inflamed with certain activities. And this is kind of highlighting the most common area we see that. So, depending on the tendon or the muscle that's involved, the pain can really be in various different locations. If it's pain more on the outside, almost where that bursa is, it's usually the abductor muscles, the ones that control lifting your leg out to the side. If you're having pain more in the buttock area, it's usually an irritation of the hamstring tendon, the one that runs down the back of your leg. And if you're having pain in the groin or kind of the crease in the front, that usually is an irritation of the hip flexor muscles. Tendonitis can present very similar to bursitis, sharp burning or aching pain, worst with engagement of the muscles. Anytime you use the muscle, it's going to be more painful. So walking, stairs, rising from a chair, things like that. And again, it's usually an overuse or an underuse injury. And again, treatment for this is very similar to bursitis, conservative management with just modifying your activity to avoid things that cause the pain to be worse, anti-inflammatories, and physical therapy. So let's talk more about some nerve issues. So a lot of you have probably heard this term thrown around, sciatica. Well, what exactly is that? Sciatica is anything that causes inflammation of the big nerve that runs down the back of your leg. So this picture kind of demonstrates the course of the sciatic nerve. It exits out your spine, and it's actually a bunch of different nerve bundles all at one, and it runs down the whole back of your leg. And it can get inflamed at any point where there's compression on it. So it can get compression at the level of your spine, at the level of your muscles, kind of in the buttock area, or even further down your leg. The way this usually presents is pain primarily in the buttock region, and sometimes that goes down the back of your leg. This is because it's a nerve issue. It's usually sharp burning or shooting pain, sometimes associated with numbness or tingling, and it tends to be worse whenever you're putting more pressure on the nerve. So when you sit for long periods of time, particularly on hard surfaces or car rides, plane rides, things like that, that really tends to make the pain worse if the compression is in the soft tissue. If it's compression of the nerve in your back, usually a leaning forward or coughing or sneezing puts more pressure on it. So those can be other indicators too. And it's, again, the cause is any kind of compression on the nerve, whether it be at the level of your spine or in the soft tissues of your leg. But this is usually something that can improve with physical therapy, anti-inflammatories. If it is related to the back, sometimes it requires further evaluation, but this is usually the first line to try and treat it. And so this is showing one of the more common areas that the sciatic nerve can be compressed. This is looking at the back of the pelvis. This muscle here is called the piriformis. And a lot of you have probably heard of piriformis syndrome. What piriformis syndrome is a reason why the sciatic nerve can get compressed. Because if this muscle gets tight, it puts pressure on that nerve, so that nerve gets inflamed. So that's kind of showing this here. This can be a really frustrating condition. I know I've suffered from it intermittently over the years, but physical therapy really can help a lot with this particular reason. Now, radiculopathy is another term you may have heard of. So radiculopathy is a little bit different than sciatica. Sciatica is inflammation of the whole sciatic nerve. Radiculopathy is usually a problem with individual nerve roots. And there are multiple different nerves that run down the leg. Each one is kind of responsible for their own function. And, they all are described by the levels. So L3, L4, L5, S1. These are all nerves that correlate with different levels that they exit out the spine. And each one has its own responsibility for motor function and sensation. So L3 tends to run more on the front of the thigh, L4 kind of to the front of the shin, L5 down to the front of the foot, and then the S nerve root runs down to the bottom of your foot. So what radiculopathy is if you get compression on any one of these individual nerves that affects it at whatever function it's supposed to do. So the location of pain from radiculopathy really does vary based upon the nerve root. If you've got compression of your L3 nerve root, you're probably going to have some pain either in the groin or in the front of your thigh. Whereas if you have an S1 nerve root compression, most of the pain is going to be in the back of your leg and to the bottom of your foot. And because it's a nerve injury, presents with kind of numbness numbness, tingling, shooting, and sometimes even an electrical shooting pain. This tends to be worse when you're standing upright. It tends to be alleviated sometimes when you lean forward. So a classic thing I ask patients is, how does your pain feel when you lean forward on the grocery cart? Does that make the pain better or worse? And sometimes that can be a really good indicator. Also, coughing or sneezing or lifting heavy objects, this puts a lot of pressure on the discs at the level of our back, and that can put higher pressure on the nerves themselves. These initially can be treated conservatively, but sometimes require evaluation by a spine surgeon to determine if surgery is needed. So let's talk more now about actual hip related issues. So patients probably have heard of this term as well, a labral tear. This can be a common reason for hip pain. And for those of you who have not heard this term, what the heck is a labrum? So I like to use the analogy of bumper cars. So when cars when you have a bumper car and it crashes into another bumper car, the reason why you don't get any damage to the cars themselves is this because you've got this nice protective bumper all the way around. Well, that's actually what the labrum is to the hip. So the hip joint is composed of all of this bone with the cartilage, which is the blue, and this little rim of tissue all the way around the circumference of the hip joint is your labrum. And so what it tries to do is buffer impact between the bone when you move the hip in certain directions. So then when you bring your hip up into high flexion, you don't get bone contacting bone. The labrum's kind of your bumper to prevent that. So without bumpers, you get lots of damage to the actual structural properties of cars. Same thing for the hip joint. When you get a labral tear, you lose that protective bumper. So you start to get bone that is just bumping up against bone, which causes lots of inflammation and pain. And that's kind of delineated by this, with the left one showing that nice protective labrum there. And here, when it's torn, you can see you get lots of inflammation and further damage to the cartilage. So a labral tear, or anything that tears that bumper, usually presents with pain in the growing. And this is sometimes described as a sharp catching or snapping pain. It tends to be worse when you're bringing the hip into extremes of motion. So high hip flexion, or walking or stairs where your hip is flexed up, and sometimes sitting for long periods of time as well, because you're constantly engaging that labral tear by having your knee flexed in a seated position. Sometimes these can happen from a traumatic injury, but sometimes they just develop from wear and tear over the years. We don't always know the reason why. And there are some things you can do to conservatively manage this, such as avoiding the high flexion activities that engage the tear and make it painful, using anti-inflammatories. Physical therapy can also be helpful for this, but sometimes this does require surgery if it's symptomatic or limiting enough to your activities. A lot of patients probably are very worried that if they're having hip pain, that it is due to arthritis. And so let's talk a little bit about what hip arthritis typically looks like to either appease or maybe support that this may be something you're struggling from. So definition of hip arthritis is basically wearing away of the protective cushioning that lines our hip joint. The reason why we can jump and play and run and not have any pains in our joints is because we have this beautiful blue protective cartilage. It's not actually blue in real life, but in this picture it is. This is like the cushioning of your hip joint. It's a very spongy surface. It doesn't have any nerve fibers, and it's a very low friction surface. It's smooth, almost like the surface of a pearl. So when it rubs up against cartilage on the socket side of your hip joint, it doesn't cause you any pain. And as time goes on, you wear this down, just like treads on your car tires. And so what happens, oops, sorry guys, is you start to get eroding away of that cartilage and bone-on-bone contact. Bone has lots of nerve fibers, so when you get bone rubbing up against bone, it can be an incredibly painful condition. And most classically, patients with arthritis are going to have pain in their growing area. Not always, but more often than not. This kind of pain is usually a constant, dull, achy pain that sometimes can be intermittently sharp. It tends to be worst with any activities where you're loading the hip joint, so walking, stairs, jumping, things like that. And sometimes even rising from a chair because you're bringing that hip into high flexion. This also can be worse when sitting for long periods of time, because as a result of all this inflammation in the hip joint, the joint gets very inflamed and it gets stiff. So when you sit for long periods of time, that stiffness really sets in and it's very hard to get the hip going. Reasons for the arthritis: probably just wear and tear, sometimes a traumatic injury, but it's usually just something that happens with age with some component of genetics. And there are some things we can do to help control the symptoms of arthritis. We can't put the cartilage really back once it's worn away, but there are some ways we can manage the pain. And then of course there is surgery if you failed all those options. Now, this is a little bit more of a rarer reason for hip pain, but I think it is important to mention. So you don't always have to have a traumatic injury or a fall to have a hip fracture, especially in younger patients. Hip fractures can happen from stress. And so this is just a demonstration of the hip joint. And these are some of the areas where you can actually get a crack in the bone. The one far over here is usually happens from trauma, but these less pronounced fractures can happen just from overuse. A hip fracture pain will cause pain in the groin, so kind of similar to arthritis, usually a constant dull or achy pain, and it's worse with any weight-bearing activities where that fracture is to just getting stressed. Can be from trauma, but sometimes just overuse, and even honestly, if you've got osteopenia or osteoporosis, you are at an increased risk for developing a hip fracture from even not very traumatic means. Usually, vast majority of these require surgery, so if anything, an X-ray can help confirm that there's no fracture present that's causing your pain. So now let's talk about some general ways that you can make your hip pain better. And now Chris is going to elaborate a lot further on this, but these are just some basic starting points. Now, the most obvious basics are, if your hip is hurting you, you should rest it, meaning avoid whatever is causing you pain. If you're doing a bunch of box jumps or running and your hip hurts, well, maybe you should stop doing that for a little while and give your hip some time to rest. But by resting, I don't mean just sitting up on the couch and doing nothing. That usually causes the joints and the muscle to get stiff. So you want to at least be doing some gentle stretching or motion, not to the point that it's causing you pain, but you don't want to be doing nothing. Ice can be helpful. Usually pain is from inflammation, and ice helps to suppress the inflammation, which helps with pain. So icing whatever area feels the most tender can give you some relief. The best medications to take for the vast majority of issues that we talked about is going to be an anti-inflammatory. So Advil, Aleve, Motrin, these are non-steroidal anti-inflammatories, which means that they don't have quite all the side effects of steroids. But this is not something everyone can take. If you are on a blood thinner, if you've ever had stomach upset or stomach ulcers or gastric bypass, or if you have any kidney problems, these are not medications you can take safely. The alternatives are, topical anti-inflammatories, which you can put on the soft tissue, Tylenol, and even actually CBD, because it's a pure anti-inflammatory, has shown, at least anecdotally for some patients, to give them some pain relief. But the biggest thing moving forward to prevent the pain from coming back is really to try and modify your activity so you're not making this issue worse. So what are the activities you should avoid? For the vast majority of the issues we described, high impact activities are going to make the pain worse. So unfortunately, running, box jumps, or any kind of jumping high impact activity is really bad for your joints and not very good for your muscles in general. That high impact activities also qualifies as carrying heavy loads. The more weight you carry on your person, the more stress you're putting on your muscles and your joints. So, for a backpacker like this is not doing him any justice for hip problems. You also want to avoid extremes of motion, particularly for hip joint related issues. So deep hip flexion can cause a lot of issues. These are examples of, putting that hip in that deep squatted position where the hip is in extreme of motion. This is an even worse example where you're adding more weight to that scenario. And as much as I love yoga and Pilates, there are some positions that are just not healthy for your joints. This being one of them. This may be great for stretching soft tissues, but man, if you've got hip arthritis or a labral tear, this is going to cause you a lot of discomfort. What are the activities that you should be doing? So anything that is considered a low impact activity. So walking and hiking are fine. That's pretty low stress on the joints, and it's good for engaging the muscles and keeping them mobile and not getting stiff. Ellipticals are also great because it takes some of that impact out while still allowing you to get good aerobic activity. Swimming is another great one. And I know this is something that's very limited to patients, especially with COVID, but if you do have access to a pool, this can be a great way to get your hips hips moving and still keep your muscles engaged without stressing your joints. And my favorite is biking. It is probably one of the lowest stress activities for your joints, but also really good for muscle engagement and toning. If you can't tolerate a stationary bike, they've got recumbent bikes that are better for people for back pain. So something to definitely look into having around, or at least access to. The other good activities are anything that engages your core. So yoga and Pilates are fantastic. Again, you just want to modify certain positions so that you're not making the pain worse, but these are great for keeping all the muscles around your spine and your hips engaged and strong, which can help with the vast majority of conditions we talked about. And, you know, if you've tried all these things and you're still having a lot of pain, the next best step is going to be evaluation by specialists. So Chris and their team at Physio Room did an absolutely fantastic job of trying to work through the issues for your hip pain and give you some good exercises to try and give you pain relief. And he's going to talk about that just a little bit here. But if you've tried all that and the pain still hasn't gone away, I think it is at that point you want to consider being evaluated. And so what is an evaluation by an orthopedist, doctor, look like? Well, you know, nowadays we are trying to be, you know, respectful of the COVID situation and make it as easy as possible for patients to get the evaluation they need. So we are doing telemedicine visits as much as possible, as well as clinic visits using, you know, up-to-date recommendations from CDC in terms of keeping our patients safe and following all appropriate protocols. So if you'd like to have that evaluation done, we'd be more than happy to see you and try to work with you to find the safest way we can do that. Now, when should you absolutely be evaluated? You know, obviously, if you've exhausted all the things we talked about and it's still hurting, but there are some red flag things that probably indicate you should be seen sooner. So what are those things? Pain lasting more than 2 to 3 weeks, not alleviated by the activity modifications we talked about. If you are having numbness or tingling in the leg, that could indicate a nerve injury. The reason is because nerves do not recover well. If there's pressure on a nerve that's causing some deficit, weakness, or numbness, it needs to be evaluated because sometimes that function doesn't come back even when you fix the problem. Any bowel or bladder incontinence, and what that means is if you are losing control of your bowels, meaning you're just having, you know, bowel movements without really even knowing it, or if you lose the ability to urinate, these can be indications of a very severe compression of nerves in your spine that need to be addressed very soon. Obviously, if you've had a fall, any kind of trauma, you probably should be evaluated sooner rather than later, especially if you can't put weight on the leg. That should probably go to the emergency department or be seen pretty urgently in a clinic. And an inability to put weight on the leg, you know, is another telltale sign. And if you have any hip pain that is associated with fevers, chills, or illness, and what I mean by that is if you become very sick and all of a sudden a joint that was not painful before all of a sudden becomes excruciating painful, that's something that should be evaluated immediately as well. And so, you know, a clinic evaluation, what would that look like if you did come in to see us? So we usually do basic radiographs of the hip, sometimes getting some of the spine as well, because a lot of hip issues, sometimes there's overlap from the spine, or it can be hard to tell if it's coming from the spine or the hip. We'd also do a very comprehensive exam to really try to tease out the source of your pain, what makes it worse, what makes it better, so we can help guide treatment for you. Every once in a while, we do need to do advanced imaging, you know, labral tears and stuff like that sometimes require an MRI, or if it's a soft tissue injury that has not gotten better. Sometimes we have to do CT scans depending on, you know, what the reason is. And, you know, if you are a patient who's requiring surgery for something, say hip arthritis, we do a lot of advanced imaging in terms of preoperative planning for a surgery, but not all patients need surgery. Surgery is certainly an option for some of these conditions, but typically hip arthritis. But our goal really, at least at CJR, is to come up with a customized treatment plan that best suits your goals and gets you back to what you want to do. Sometimes that does involve surgery, but we really try to do everything possible to make sure that it doesn't. So with that, I really appreciate your time. I hope this was helpful information for you. Always happy and available to chat further or evaluate you individually to help figure out sources of your pain. These are our two offices, again, at Porter Hospital and at Lone Tree. And with that, I'm going to hand it off to Chris to kind of talk a little bit more about some strategies to help with hip pain conditions. So thank you very much.
All right. Well, I think just to kind of piggyback what Dr. Kleeman just said, first and foremost, when you go see an expert, whether it be an orthopedic surgeon or a physical therapist, you're not really buying their treatments. What you're really buying is the plan and buying the diagnosis, and all of the follow-up. So as a physical therapist, I get to work with so many different physicians across the Denver metro. And I can tell you that Colorado Joint Replacement and Dr. Kleeman are absolutely at the top when it comes to the follow-ups after the surgery, after their treatments. And that starts in the beginning on the onboarding and making sure they have a plan and they have an accurate diagnosis. And it is not just cookie cutter, and they're making it specific to you. So kudos to your team, Dr. Kleeman. Again, time and time again, we see knee replacements come through our clinic, and they are by far and away, the least amount of issues, because some physicians just kind of turn them and burn them. And in your practice, it clearly cares and follows up more than anybody else does. So I can't recommend Dr. Kleeman and her group enough. So as we go through this, a little bit about me. I have 3 little kids, 3 kids under 5. It makes me very busy, but I'm not saying busy anymore. I'm saying blessed. So I do have about 10 years experience as a physical therapist here. And am I here?
You're good. We can see your screen great.
Okay, and you can see me talking all right? Good.
Yep.
All right, and so I've reached this point now where we've had 10 years experience, and we've been able to reflect and kind of diagnose a little bit more and see these patterns. So I'm really excited to dive into this, because we've seen so many people and we've helped so many people avoid unnecessary surgery because they can do a few things on the beginning side. But there's always time for that surgery. Here we go. Let's go here. So as we go through this, when I opened up Physio Room, it was 100% about the relationships. I sold a practice prior to this that was in network, and I was seeing 20 or 30 people a day, and it just wasn't the quality of care that I was looking to provide. And so as I opened up Physio Room, we are seeing 20 to 30 people a week, and that allows me to spend an hour one-on-one. That allows me to listen. That allows me to understand, what are your goals? Where are you in your journey? And what can I do to help you get back to doing what you love to do? And when you do that and you have the time to listen to folks, you're able to actually get to the root cause. You're not just treating the symptoms, and you're not just treating pain, but you're able to understand, where is this originating from? What are you doing in your day? And how can we modify those activities to allow you to continue to do what you love to do? So as we continue with our hour-long sessions, we do not use techs or aides. We do not treat multiple people at the same time. And that does allow us to educate you on what you should be doing on your own at home, and how we can help you get out of this so it doesn't keep coming back. And with that, we are able to spend the time that we need to do some of the things that you can't do. We do a ton of dry needling and adjustments and all these other things that you can't do on your own at home. And that manual therapy and that manual touch is so therapeutic for most folk. So as you go through that, that is kind of our journey. As you come into our process, the Physio Room journey is, we want to reset that nervous system, and we want to decrease any kind of sensitivity that you have. We're going to decrease your pain, but we're also going to restore normal range of motion and make sure, and more importantly, get the right muscles firing at the right time. And I think that's what today is about for us. I wouldn't be a good physical therapist if I didn't have you move a little bit today. So that's where we get into reload. As we start to restore normal range and normal muscle firing, we start to load those tissues. And as we load, that's a way for us to become more tolerant. That's a way for us to allow our clients to be able to become harder to kill human beings. And I say that jokingly, but when you lift weights, you're able to then tolerate more daily activity and go out and enjoy what you love to do without flare-ups, without injuries happening. And it just makes you a more tolerant human. So as we go through this, that is our 3-step process. We do like to educate. We do like to get you to move, and we do provide that hands-on therapy here. But as we go through this, one of the most important things that we say is movement is medicine. And you can't stress that enough. No amount of medicine can replace any amount of movement. But movement absolutely can replace medicine. And what we mean by that is we have to dose movement appropriately. Think of movement as medicine. And when you have a headache, you don't take half of an ibuprofen for your headache. You may take the prescribed dosage. Is that 2? Is that 3? But you're not going to take the entire bottle. And so as a physical therapist, that's where we come in and we try and show you where are you and how much movement is appropriate for where you are in your journey. Because where you are right now may not be where you want to be, and where you want to be is not the same as your neighbor down the street or their cousin in Ohio. That's to say that we have people out here that like to run 1 mile. Maybe they want to run a half marathon. Or maybe you're a crazy ultra and you go up to Leadville and you run 100 miles. There is an appropriate amount of movement for each individual, and that's where we want to help you reach your goals and understand what it is that you're trying to get back to. So what is physical therapy? Again, I kind of referenced that a little bit when I talk about Dr. Kleeman and her group and how they do such an amazing job with the follow-ups. Physical therapy is not dry needling, adjustments, cupping, Graston, corrective exercises, blood flow restriction, stretching tight muscles. Those are all very, very good treatments, and those are all things that we do in the clinic, but those are all treatments that are part of a bigger, broader plan that allows you to then get to your goals. And that plan is understanding that you're rowing the boat in the right direction and you're not just rowing around in circles. Dry needling in our clinic is a great first option when you talk about hip pain. It is a way to decrease muscle tension, kind of restore normal blood flow to those tissues, and it's a way to decrease some inflammation. But dry needling, adjustments, cupping, these are all things that are going to allow your symptoms to calm down enough to then allow you to start to move properly, get range of motion, and then we can start getting back into some loading and getting you stronger so that you can tolerate those activities and you don't have those flare-ups. All right, so when we look at things, and I talk about this all the time, we don't want to just chase symptoms. That's one of my biggest pet peeves is if you have something going on in your hip, what's causing that? Because there are a lot of things that can create that, as Dr. Kleeman just talked about here. And I always use the analogy of you've got this brand new washer and dryer, you just moved into your new house, you've got a washer and dryer, and a rat came in and chewed up the wires, now your washer and dryer is broke. Well, you can get a new washer and dryer and that's fine, and then it'll start working again. But if you don't fix the hole where the rat came in, chances are those wires are going to get chewed up again and it's going to come back. So if you are going to a massage therapist or a chiropractor or a physical therapist and all you're getting is passive treatments and you're not getting this full plan, then you're not fixing the root of the issue and not solving the actual problem. And you're just fixing your symptoms, and you may feel better, but that may be short term. So as we talk about that, there are incomplete movements. So today we're going to go through a few movements that I really want you to think about when we talk about the hip here. And incomplete movements start to create irritations, and those irritations then start to create these incidents. And so an incident is like, oh, I went on a hike and now I have this achy, tweaky hip flexor. So now it hurts when I go up the stairs. So it's not really like injured, but you feel it. And then a series of these incidents then creates injuries, and that's where you end up seeing an expert like Dr. Kleeman or myself. And so what we want to do as a profession here, we want to get people to think proactively and preventatively, and we want to not just react to our pain, but we want to think about how can we avoid this in the first place, and that's what we can talk about today here. All right, so let's talk about a hip hinge versus a squat here. So as we go through this, what I really want to do is talk about the difference between a squat and a hip hinge. So I want everybody to kind of stand up with me and think about this. As we stand, we're going to try and engage our glutes a little bit more. So as you engage your glutes, you're just gonna squeeze your glutes together like you've got a winning Powerball ticket back behind, and don't let me take that. As you're squeezing your glutes, you should think about a little rotation happening in your femurs. So again, one more time, squeeze your glutes and almost rotate your knees outward as you're squeezing your glutes. As we do that, let's talk about the difference between a hip hinge and a squat, because both of them, we're going to want you to be a little bit more hip dominant than quad dominant. A lot of times hip issues are stemming from an overactive quad, and we're very dominant in our movement patterns here. And what that does is creates tension here and tension in your back. And those two things lead to nerve issues that are in your back that refer down to the hip, and lead to an imbalance in the hip and a lack of stability through the hip joint. So as we talk about this, when we are going to the gym and we're doing an exercise class, I want you to ask yourself, is this a hip hinge or is this a squat? The first thing is a squat. Let's talk about that. Your hip is going to go straight down and your knees are going to go forward. So we're just going to allow that to happen here. So hips are going to go down, knees are going to go forward. My knees are over my toes. That's okay. When your knees go over your toes, that's not a bad thing. That can create a little more irritation in the knee. And if your knee is irritable, then I'm not going to ask that you do very much of these squats. But one more time, we're going to squeeze our glutes. We're going to allow our hips to go down, our knees to go forward, and then drive those knees out so that you can feel that in your glutes. If you're squeezing your glutes at the bottom, what's going to happen is you're going to open up the space here. If you don't have your glutes engaged and you squat, you're going to feel a lot of pressure in the front of the hip there. And that's where we can start getting a lot of this irritation. Dr. Kleeman referenced bumper cars bumping into one another. Well, that's fine. You have that bumper, but if you are consistently bumping up against that, that's where we lead to unnecessary stress and strain. That's where you start getting issues and inflammation into the joints to where you are creating those bursitis and tendonitis type issues. So again, your squat, squeeze that glute. We're going to go down. Don't let those knees fall inward. We're going to drive those knees out. Squeeze your glutes real tight the whole way, and don't lose those glute squeeze throughout that squat. All right, so that's a squat, and that's a really good movement. We do a lot of squats throughout the day, and what I want you to think about is let's try and do more hip hinges. So as we hinge, the difference is going to be we are not going to allow our hips to go straight down, but our hips are going to be on a rail, and they're going to go straight back. So initiate with your hips. Your hips are going to go back. Your knees are going to bend. So as your knees bend, they're not going forward because that's going to be a squat. So think about this. You're in a ski boot and you cannot let your knees go forward in that ski boot. So as you go, your butt goes back, your glutes are squeezed, your knees are rotated out, and you're really feeling a good pull almost through your hamstrings. So that's the difference between a hip hinge and a squat. And when you look at these two pictures right here, this is exactly what we were trying to get you to feel and do here. So in that first position, you can see his knees over the toes, and you can see his torso is a little bit more upright, and that's going to be a little bit more quad dominant, versus as you get back into the hip dominant here, his butt goes back, his shins are more vertical, and because his shins are more vertical, he has to get more forward in his trunk. That's where you come in, and we can help you decide how should you be moving. Because if you've got a really irritated hip flexor, perhaps maybe you don't want to do this hip dominant type hinge pattern here. And we can help you decide where you want to be in that. Again, you can see, I put this picture up here because you can see some of the common faults on the right side. You can see at her feet, let's just start at the bottom. At her feet, her feet are collapsing inward, And when that collapses inward, the knees will go inward, and that is going to create pressure in that hip there. And she's not going to have very much stability through the hip. And then if you look in her spine right there, you can see there's this big arched curve in her spine. Again, that's where the glutes are the key to most low back and most hip issues. If you can get stronger, more active hips, you can have more stable trunk and hip joints there, and less stress and strain, which is less irritation. So as we go through this, all right, so again, this is just another variation of that. We see a lot of folks with plantar fasciitis, and a lot of times it's because those glutes aren't firing and their foot is falling inward, and that stretches the plantar fascia. But again, that creates knee pain, and again, that goes up to the chain, and that can create a lot of hip issues. So when you're talking about the hip, one of the best and most bang for the buck things you can do is figure out how to get more glute activation there. So as we go through the hip, Dr. Kleeman talked a lot about some nerve issues. And you're like, well, I thought I was talking about the hip today. Why are we talking about nerve issues? And that is because those nerves do refer down to the hip. And what happens as humans, we don't like pain. So what do? We guard against that. And that's where that irritation in the nerve creates an irritated sciatica nerve, which creates that piriformis to spasm and strangle that nerve. And those are things that we can avoid by having A, more glute activation, but B, more core activation here. And I like to give you this picture here because I would say that bird dogs are one of the #1 most prescribed exercises in physical therapy, and they're done wrong probably 50% of the time. I give you this because in this picture, do you think that is a good position or a bad position? It looks pretty good, right? I would say that she could probably get a little more ribbed down here and get a little more, Pilates instructors will like this, neutral in her pelvis alignment. And with the ribs coming down, you're gonna shorten that space. You're not gonna arch as much. And as you do that, as you don't arch, you don't put pressure on the nerve. That nerve doesn't get irritated. And that doesn't refer down to your hip to where you have your hip pain. So a lot of hip issues do stem from the back, and we can help by teaching you what neutral is here. So go ahead, you can do this sitting down, you can do this standing up, but put your hand at the lower part of your ribs. You can kind of feel your rib cage. Put your hand near your pubic bone. There is this space between the two there. And as you do this, go ahead and tilt your pelvis back, and the space gets shorter. And get your ribs down and that space gets shorter. I'm not crunching forward. I'm not going like this, but I'm just creating a little bit of a brace moment, like somebody's gonna punch you in the stomach, and you contract those core muscles. And as you do certain exercises in your fitness routine, whether you're going to the gym or you have something that you're doing in your basement in one of your classes, try and think about this as you're doing core, as you're lifting overhead. There are movements, especially as we're talking about the hip today. If we're doing squats and hip hinges, that's exactly where we want to be. Because if I'm doing a hinge and I'm hinging here in this back arch position, that is going to create that irritation, and that's going to refer down to your hip. So we talk about core and glute activation and getting the right muscles firing at the right times. And that's part of that restore moment in our journey and your map towards your goals. So as we go, we've talked about how when you have hip pain or when you have pain in general, whether it be the neck or the back or wherever, as humans, we don't like pain and we guard against that. And so one of the biggest and tightest muscles that we have is that hip flexor. So what you can see here is one of the best stretches that we give. I like the kneeling version better. The guy on the left is probably where you want to be. You don't want to be the guy on the right there because he's arching his back. That can create that nerve compression. And so we want to maintain that normal kind of core engagement that we just talked about. You want to kneel down on the leg that you're starting, that you want to stretch. And with the opposite leg there, you just want to lean forward a little bit. So I'm going to just demonstrate here real quick. That looks very much like this. We want to kneel down on that right side, step forward. We want to tighten our glutes up so that our pelvis rotates back. When you're in this position and you squeeze your glutes, or if you're standing, you don't want to kneel right now. If you stand right now and you squeeze your glutes, your pelvis is going to rotate backward. That's going to get you into a more neutral position. And when that pelvis rotates backward, that allows us to stretch this front of the hip flexor much more effectively than if you're letting your hips roll forward. So again, as you do this, tighten your glutes, feel that stretch through the front, and then you can maintain that and take your other knee over the toe, and you're gonna feel that stretch. As for most stretches that we do, we wanna hold that for a minute, 30 seconds or less. It's kind of like stretching a rubber band. It goes right back to where it started. So you're going to be able to maintain the benefits and get more value out of that stretch the longer you hold it. Intensity is never our friend when we're talking about irritation and pain. We want to go with more frequency, lower loads, longer durations, and those are what we can be more consistent with, and you'll get better outcomes as you do that. So
that will conclude our Hip Pain Explained seminar. I just want to say thank you on behalf of Dr. Kleeman and myself for giving us an hour of your time. Hopefully you have a better understanding of what might be going on with your hip. And if not, you now have some resources and have an idea of where you can go for some support and some answers. I definitely encourage every one of you to reach out to Dr. Kleeman or myself here and utilize us as a resource to ask any questions you have. We're both very excited to help more people get back to doing what you love to do and would love to be a part of your journey. So thank you very much and have a great day.